You are welcome for this lecture in Basic Pharmacology, a course unit that is done by pharmacists, by nurses, medical officers, and other allied health professionals. Now, with this course unit, we basically first have to have or introduce a few terms, and so by the end of this lecture, you will learn about quite a number of terms, and these are the different terminologies that we are going to talk about one at a time, because you will find them being used quite often. So the first term that you will find quite often used that we are actually doing is pharmacology. Now, pharmacology comes from two words, pharma and then logy. Now, pharma simply means drug, while logy is to study. So in a layman's language, you can say that pharmacology is a study of drugs. However, it's not only about that, but we also study about their actions, their uses, and how they are actually extracted from wherever they are extracted. In other words, what we refer to as the sources, their sources. Now, the other term that is very important is a drug. A drug is basically any chemical that has an effect on the body. Now, this can either be food or a herb or even these normal medicines that we actually take. That is actually why the authority that is responsible for all drugs and foods in one of the greatest countries, the US, is called the Food and Drug Authority. So a drug is anything that basically has an effect on the body. And then the other term that we want to look at is pharmacopoeia. Pharmacopoeia. And pharmacopoeia here is the list of all drugs that are authorized to be used in a particular country. Now, there are so many countries, as you know, in the world, and most of these have what we refer to as pharmacopoeia. In other words, they allow some drugs to be used in their countries and not the others. An example is the United States Pharmacopoeia, commonly written as USP. United States Pharmacopoeia, commonly written as USP. United States Pharmacopoeia, yeah? Commonly written as USP. But we also have British Pharmacopoeia. We have Indian Pharmacopoeia. We have European Pharmacopoeia. There are essentially so many. Japanese Pharmacopoeia, you know. There are essentially so Chinese Pharmacopoeia. So there are essentially so many, especially those that come from the developed countries. And then these drugs are published in a book called a National Formulary. I'm sure you have heard about what we refer to as the British National Formulary, or BNF, yeah? Or even the United States National Formulary, UNF. So these depict the drugs, or these books contain all the drugs that are authorized to work in those big countries. Now, in low-resource limited countries, we usually copy from those. Yes, we have our own pharmacopoeia, local pharmacopoeia, but when we have, or when we see a drug is authorized to be used in maybe Britain or United States, then we also take it up. Now, that is what we refer to as pharmacopoeia. The other term is medication. Now, medication is different from a drug. Now, a medication is generally used or is administered for quite a number of purposes. Some of these One is to diagnose a disease. There are some medications that are given to diagnose a disease. Like, for example, there's a drug called edrophonium that is basically used to diagnose a condition called myasthenia gravis. So it's given for the purpose of diagnosis. But it can also be given for a purpose of treatment and cure. Like, for example, antibiotics, antimalarials. These are given for the treatment of cure. But they can also, that substance can also be given for the purpose of mitigation and prevention. There are quite a number of medicines that are given for that reason. Take an example of vaccines. In this particular context, they would be referred to as medications. Now, the other term we want to define is a prescription. Now, a prescription is basically a written order or direction from an authorized person, in other words, someone who is authorized to prescribe, to a pharmacist so as to dispense this medication or so as to administer this drug. And so that is what we call a prescription. Now, we shall see ahead that in several countries, or even in this country, several people or several professionals are authorized to prescribe. Like, for example, medical officers, dental surgeons, veterinary officers. These are some of the authorities or professionals that are authorized to prescribe. Now, the other term that we want to describe or define is what we refer to as therapeutic effect. Now, when you take a drug, you take that drug for a primary reason. And that primary reason that is intended for that drug to be taken is what we call its therapeutic effect. Like, for example, if you have flu, then you take a drug that will help you take away the flu. So taking away flu is what we refer to as a therapeutic effect. If you have a bacterial infection in your body and then you take an antibacterial, then the primary effect or the therapeutic effect is for it to destroy and kill the bacteria within your blood. So that is what we refer to as the therapeutic effect. However, because not every good thing probably comes with a bad one, drugs are associated with what we call adverse or side effects. And the side effect basically is that unwanted. It is the unwanted effect or unintended effect of this drug. It is usually not harmful. However, if for some adverse effects, if it is too much, usually the recommendation is that you stop taking that medication. But usually these adverse effects are not harmful and they are usually predictable by the mechanism of action of these drugs. I'll give you an example. You have flu, you take cetirizine, then you expect one. For cetirizine, you will no longer have, you will no longer produce the mucus, that, that watery discharge from the nose. You will no longer do that. However, throughout the day, you might feel dizzy or wanting to feel sleepy. And in that context, then, you will, in that context of feeling sleepy or dizzy, that is what we refer to as the side effect. It is not intended, but by the mechanism of action of this drug, you tend to realize this. The other term that we want to talk about is drug toxicity. Now, drug toxicity basically means the harmful effect of the drug on the organism or tissue. And it usually results from either an overdose or what we refer to as inappropriate use. Quite often, you have heard about maybe a patient says that, I had to take an overdose of paracetamol, yeah, and taking an overdose of paracetamol, if you exceed 4 grams a day, that it basically ends up to be toxic. Yeah, so that's what we refer to as drug toxicity, and it can easily kill someone. The other term is drug allergy. You have heard that sometimes patients are asked whether they are allergic to particular drugs or not. Now the issue here is that drug allergy is an immunological reaction that you have in your body as a result of taking this drug. And it can be dangerous to some patients. And so that is why it is very important for prescribers to always ask their patients whether they are allergic to particular medications, and so that they can have either suppress their immunity or they can give them an alternative medication. I'll give you an example. Some people are allergic to penicillins, and these are antibiotics. And so if a patient is allergic to a particular penicillin or penicillins, then they are given an alternative. The other concept that we want to talk about is what we refer to as drug interaction. Now, when you administer more than 2 drugs, most probably at the same time, especially if these drugs interact with each other, then you will not realize, the effect of one. That basically means that if you take these drugs at the same time, one will kind of in a way affect what we refer to as the pharmacokinetic and pharmacodynamic properties of the other drug. And so this drug which has been affected, basically if its effects are altered in a way. And so in medical practice or clinical practice, what we usually recommend is that if you have to take 2 drugs that are known to be interacting with each other, then the recommendation is that either if they have to be taken, then you do not take them at the same time. Because if you take them at the same time, then they'll affect each other's, pharmacodynamic and pharmacokinetic properties, as we shall see ahead. The other term that we want to define is what we refer to as drug misuse. Now, this is basically the improper use of common medications, and this can lead to disastrous effects of acute or even chronic toxicity. An example here is that if you overtake antacids, then you can end up with this is referred to as drug misuse. Common example is during COVID. People would buy quite a lot from the pharmacy vitamin C. And because of that, then the authority that is responsible for medications, the National Drug Authority, had to restrict pharmacies from selling these, because in the population or in the public, vitamin C was being misused. So as a result of misuse, it can lead to disastrous effects, either acute or chronic toxicities that can even end up to be lethal to a patient. The other term that we want to define is drug abuse. And this is basically the inappropriate intake of a substance. So in other words, you do not take it appropriately. Instead, you inappropriately take this substance, either perpetually, continually, or even periodically. So, and once you do that, then it will also have disastrous effects on you. Because of drug abuse, that brings us to another term, which results into drug abuse, which results from drug abuse, and that is none other than drug dependence. This is when a person basically becomes reliant and needs to take this drug yeah, and cannot do anything, yeah, before they take this drug. Quite often you've had people tell you that, you know, I cannot stand in front of a public without taking alcohol or without smoking weed. So in other words, these patients have become dependent, and it all started from drug abuse. Yeah, so they have become dependent, and this all started from drug abuse. Now there are two types of drug dependence. There's what we call physiological and psychological. Now with physiological, the drug basically changes what we call the biochemical and physiological properties of the body or cell tissues, yeah? And so you require this substance for you to kind of function normally. That is what we refer to as physiological dependence. And then of course psychological is when you attach your emotions, when you emotionally relate to that substance, when you emotionally relate and rely on that substance. And so you feel that your well-being, yeah, in other words, you feel that, you know, your well-being will basically depend on this drug. We also have another form, what we refer to as drug habituation, and this is a mild form of psychological dependence. Now, the other term that we want to use is to define is what we call an illicit drug. Now, these are drugs that are sold illegally in that particular country. Some substances are illegal in some countries, but then they are authorized to work in other countries. Like, for example, cocaine. In some countries, like Canada, it is put even in some medications. And so, it is not a big deal. However, here in our country, and in most low-resourced, limited countries, like Uganda, cocaine is not a legal drug to be used here in our country. And so it is termed as an illicit drug. And so when you're caught in possession, you're sentenced either to 10 years and a fine, or sometimes life imprisonment. Now the other term we want to define is a dose. Quite often you go to a hospital, and let's take an example. If you have a bacterial infection, then they prescribe for you an antibiotic that you're supposed to take frequently, yeah, depending on which particular kind of antibiotic. Now, that amount that you take in a day is what we refer to as the dose. And the aim of this is basically to help achieve the intended effect or the desired effect of this drug without causing any harmful effect. I'll give you an example for adults. Usually, if you have fever or mild headache, we usually prescribe for them a drug called paracetamol. A drug called paracetamol. Paracetamol. Now, paracetamol in adults is usually given as 1 gram TDS 3 times a day. Yeah? So in other words, this 1 gram 3 times a day is what we refer to as the dose. And it is intended to bring about the desired effect and not cause harmful effects to this patient. And so that is what we refer to as the desired dose. Now the other term that is very important is what we refer to as therapeutic index. Now with therapeutic index, It's basically that range beyond which, when you administer a drug, it will not be effective, rather it will be toxic. And below that, when you administer that drug, it will not work, or you will not achieve the desired effect. And so that range is what we refer to as the therapeutic index. And just to demonstrate that, assuming you have a drug A, and then maybe at this point, beyond this point, if you administer the drug beyond this point, then you will have what we call, it will become toxic. And if you administer the drug beyond this point, then you will not realize any effect. So this range here, at which you are at liberty to prescribe the drug, is what we refer to as the therapeutic index. Yeah. So if you prescribe beyond that, the drug will be toxic. If you prescribe below that, the drug will have no effect. That range at which you are at liberty to prescribe or to write a dose is what we refer to as the therapeutic index of the drug. Now, one particular concept that is important is that a drug which has a small therapeutic index is actually dangerous compared to a drug which has a high or a wide therapeutic index. This is what we mean. If you have a drug A and it has the therapeutic index this, it has a therapeutic index as that, and then you have a drug B which has a therapeutic index as that. So for drug A, this is its therapeutic index, and then for drug B, this is its therapeutic index. Yeah. So that essentially shows us that drug B is actually safer to administer compared to drug A. Because the moment you make a mistake of administering drug A and you slightly go beyond, or the moment you make a mistake, the drug can easily become toxic. However, for this, you have a broad range through which you can actually administer this drug. And so that is what we refer to as the therapeutic index of the drug. Every medication has its own therapeutic index. Like, for example, aspirin has a therapeutic index of 3.5, and then digoxin has a therapeutic index of 2. Now, the other term that is important is referred to as bioavailability. And bioavailability here basically means that amount of the drug that will reach systemic circulation after being administered. Like, for example, you take paracetamol 1 gram orally, but in the blood, when we do plasma concentration, you might find that the concentration of paracetamol in the blood is maybe 500 milligrams per deciliter. So that essentially means that some of the administered, or some of the milligrams that you took orally did not end up in blood. Now you'd wonder where they went. Of course, if you take something orally, one of the reasons is that not all of it is absorbed. And the other reason is that some is passed out in fecal content or fecal matter. And so when you do plasma concentration of this drug that you took orally, in most cases, its concentration is usually less than the dose that was given earlier. And so that is what we refer to as bioavailability. Now, intravenous drugs intravenous drugs, or what we refer to as IV medications, intravenous, they have 100% bioavailability. In other words, once you administer this drug in the blood intravenously, then all of it will go in the blood. However, oral drugs have a bioavailability of less than 100. So oral drugs that have been administered have a bioavailability of less than 100. So it can be 60, 80, or even 50, or even less than that. Yeah? So the point to take home here is that how much eventually gets into the blood, and that is important, as we shall see, by the way, in pharmacokinetics, that what gets into the bloodstream is what ends up to be, or is what ends up to create the desired effect. And so that the concept of bioavailability is very important. We shall meet it also when we are talking about pharmacokinetics. The other term that we want to talk about is tolerance. Now, in tolerance, it's basically a decreased response to repetitive administration of the drug. I'll give you an example. One time, you can take coffee, this normal coffee that we drink, and if you take it maybe at night, you may spend the whole night not sleeping for the first time. However, when you continue taking it, in the night, you end up sleeping. Why? Because your body has developed tolerance. Your body has developed tolerance. So with tolerance, the issue is, or one of the things that we shall see, especially when we talk about pharmacodynamics, is that there is an effect of what we refer to as desensitization and downward regulation. So in other words, the body gets used, and sometimes the receptors, that we shall see that there is what we refer to as receptors on which the drugs have to work. The receptors are desensitized, and so the body ends up developing what we call tolerance. Now, what we usually do for these medications, you give a break. You give a break. Like, for example, for nitrates, they usually give a break, and then you can start again, so as to prevent this effect of tolerance. All right, ladies and gentlemen, those have been the basic terminologies that we use in basic pharmacology, and you will find them quite often being used. And so we shall have to do a test on those, and upon passing the test, then we shall go and do something else, and that will be none other than the subdisciplines in pharmacology and what we refer to as drug nomenclature.